So our first speaker is Michael Reich, who's thankfully took on the task, not only of, he had worked in public-private partnerships and governance from the point of view of Harvard for a number of years. So we didn't want him to revisit the work that he had done before, and he really has taken on a synthetic approach and really put something on the table. But given that I know his rule is he never does what he did before, he already wrote the paper. That's a draft. And so what he's going to talk about are additional thoughts that you may not have considered. And so I'm really looking forward to see what he's going to say. Michael?
Thank you very much. Good morning. Good morning. So it's a pleasure for me to be here today. And thank you for the invitation both to write some reflections and also to present to you. I must say, it's nice to have this opportunity to return to an event where I can see some people I haven't seen for a long time, and to also return to some topics that I haven't thought about for a long time. I want to start with an apology. This may be kind of a Japanese old habit, but I unfortunately have to speak and run. I'm in DC I'm the faculty director for a course at the World Bank called the Flagship Course on Health System Strengthening Sustainable Financing. It's something that I've done for over 20 years. We've trained over 20,000 people globally. It's relevant because in many ways this is a public-private partnership, but the course is on the other side of DC and I have to get back there. So I'll leave about an hour or so after the talk is finished. So this is what I was asked to do. The invitation said a 15 to 20-minute presentation on the evolution and trends in the governance of global health PPPs, reflections on significant issues, current challenges, etc. And my first reaction was something like, oh my God. You know, what could I say about this, and did I really want to go back and revisit these things? And so my thought was, do I have something useful to say? Do I have any ideas? Of course, an academic with nothing to say is sort of like Trump without a tweet. You know, there's always, academics are willing to talk about almost anything with great certainty. And so I reflected on it for a while, and then I had an idea. So that formed the kernel of the paper. And what I'll do in this presentation is present some of the big ideas, some of the ideas in the paper, plus a couple of additional ones that I've had since. So I actually have had a long relationship with PPPs. It's work that I did in the 1990s. We organized a conference at Harvard in the year 2000. We did a book. The meeting was attended by some people who are here, sponsored by some of the organizations who are here. If you haven't seen the book, it's available online at my Harvard website for free. It actually has some interesting case studies and some interesting ideas that are still relevant. And I then did some additional papers and analyses in different settings, different kinds of partnerships, sometimes looking at successful partnerships, sometimes looking at unsuccessful partnerships, and eventually even helping to start some partnerships. So I've had a kind of personal engagement. The first question really is what do we mean by a PPP for global health? And there is a definition here that the forum provides of what they think about as a PPP. I think it's important to note that there's a whole range of actors that are involved and a broad range of stakeholders. And as I thought about it after I wrote the paper, there's actually a broad range of partnerships. So I started to think about what are the different kinds of partnerships, and I came up with this kind of a way of dividing them. First, thinking about domestic and global, understanding that this group is primarily concerned with global. Then thinking about, well, there are informal partnerships that are kind of a handshake. Let's do something together, where there may not even be any written documents, versus a formal partnership. The formal partnership can then be something that uses existing entities. So it could be within a company, within an international agency, within a university, within an NGO, and the technical legal term is a kind of contractual joint venture. So there's a contract that governs the terms of how the different groups work together, versus where you create a new standalone separate entity which has its own terms of how it operates, which is called a special purpose entity. And those can then be divided into for-profit as well as not-for-profit. So there's a whole range, and if you think about governance, there may be different kinds of governance structures, processes, and practices for different kinds of partnerships. And a single PPP can also move across these in different ways and evolve. The next is the question of governance. So governance is a relatively new term. This is a Google graph of the use of the term. It basically, I mean, you can extend it all the way back to the 1880s. It didn't exist. It's a relatively new thing that really grew in the 1980s. It still is not something that has a kind of stable definition. So you could take, I'm sure I could ask people to write down their definition of governance here, and we'd have 50 different definitions. There's not like an equilibrium governance. And the Academy's definition that's used in the document is steering. So here we have somebody steering, and then in addition to steering, we have people who are rowing, and sometimes we have a steerer inside with the rowers, and sometimes they're separate. It was interesting to me that the definition used by the forum comes from the Canadian Institute on Governance, which I thought was an interesting place to look. And even the Canadian Institute on Governance says, well, governance, it's not well defined. It's, some people think about it as steersman, but it's messy, tentative, unpredictable, and fluid, multiple actors, not a single helmsman. And this becomes even more complicated when you're dealing with PPPs. You have multiple partners, you have different languages, different values, different expectations, different cultures. So I thought what would be the appropriate metaphor? Maybe the metaphor thinking about governance of PPPs is herding cats rather than steering and rowing. So to help me with my task, the forum provided me first with an initial review of the literature, which was, I think, 26 key works that I looked at. And then I said, okay, I'll do this. And they said, to help you, we'll give you a thorough review. They gave me 519 titles and abstracts. And it was like 160 pages of summaries with a variety of search terms. And I looked at that, and I read through it, and my basic conclusion was the technical term would be something along the lines of, this is a mess. And I really didn't come out with anything clear that stuck with me until I thought, well, could I come up with some simplified way of thinking about this? And I said, the two terms that stuck with me were transparency and accountability. And some of the writings use them as within each other. So transparency is usually seen as a means to accountability. And I thought, well, what happens if we separate them and look at them as separate dimensions, separate objectives, and look at them as orthogonal? And if you look at them as orthogonal, then you can think about, I say to my students, one of the sort of simple-minded social science techniques is to create a 2x2 table. So you can come up with a 2x2 table of accountability and transparency and begin to think about, well, what is good governance and what is not so good governance? Where do different organizations fit? And I thought, well, maybe this is an interesting new way of thinking about governance. And as these two core dimensions, along which to both organize a partnership as well as potentially design a partnership, as well as to evaluate partnerships. And intuitively thinking, we probably want we probably want organizations that are partnerships that are serving social goals that have reasonably high accountability and reasonably high transparency so that we actually know that they're serving social goals and not going somewhere else. I mean, if people are interested, I began to think of examples of organizations. For example, someone said to me, can you think of something that's low transparency and high accountability? So this started me to think about, well, you know, it's transparency to whom? So you might have low transparency to the public and high accountability to some small group. And I began to think about, well, in sort of public diplomacy, you might have a committee in Congress that oversees secret operations. They might be accountable to the committee, but the transparency outside is low. The transparency to the committee would be presumably reasonably high. So different kinds of organizations serving different goals can fit into different categories. But that started me moving from this idea of let's have some simplicity and clarity, of course, moving to a little bit more complexity. So this model is, I go back and forth saying, well, are these the two dimensions or only two dimensions? One thing that some people say is partnerships and other organizations should have the importance of participation. So participation of stakeholders. And so that, you know, you could have that as a third dimension and a three-dimensional cube. I thought that's kind of complicated. And actually, you can think about participation as one of the means to either transparency or a means to accountability. And the other big caveat is that it doesn't tell you how much of these you want for either a specific organization or for a class of organizations. My argument is it does help improve clarity, and it may be helpful in actually using the ideas. So my goal here is not simply to say, here's a new little model to play with. One of the other things that became clear to me from the literature review is there are lots of models and not much application of the models. So again, you know, academics like to come up with models. The models are not always something that is useful. As someone who's worked for almost 4 decades in a school of public health, we like to think of ourselves as practical, pragmatic people and doing things that actually can be used. So I'm going to briefly go through the two dimensions. For each of them, I divided them into transparent to, so information to whom, information on what, and information how. So mechanisms. So for both accountability and transparency, I use the same dimensions that then start you into a much more complex set of questions. They're complex both in terms of the empirical, what actually is done, as well as the normative, what do you think should be done? Who should get what information provided how? I'm not going to, and on information, I divided it into information on inputs, how much money, how many people, what kinds of patents, processes, so how the organization operates, outputs, which are, in some sense could be, if it's a vaccine, the number of vaccines produced or the number of vaccines delivered, versus outcomes, which are the actual changes in health status or satisfaction, the ultimate performance objectives. These are sort of standard evaluation concepts. And you can think about lots of different ways, mechanisms for getting transparency. So in some sense, the question is, well, why is transparency important on its own? And first of all, it allows learning. You know what happened with partnership A so that partnership B has the potential for not repeating the same mistakes and maybe moving forward. We're interested in transparency for the sake of democracy, of knowing what organizations are doing. It does contribute as a means to accountability. It's hard to be held accountable if you don't know what's going on, including metrics, measurement. It shapes organizational performance. So what is going to be published will affect what the organization does. If it knows that its number of vaccines produced are going to be made public, it will presumably try to produce more vaccines. And it also shapes public perceptions. So accountability is typically thought about in terms of two dimensions. One is answerability, and you can think about that as the ability to ask questions. What are you doing? Why are you doing it? Are you meeting certain targets? And if not, why not? And sanctions is the word that's usually used, but you can think about it also as sanctions as rewards, as well as rewards. So actually trying to get organizations to achieve certain objectives, and if they don't do it, there are consequences. This is one definition that I rather liked: the ability of one actor to demand an explanation or justification of another actor for its actions, and to punish the second actor on the basis of its performance or of its explanation. Okay, that's a pretty stern notion of accountability. We just need to look around us to know that electoral accountability is not sufficient to shape performance. And this is not a simple process. So it has ethical dimensions, it has technical as well as political. The same kinds of, I use the same kind of framework. So accountable to whom, and you have a whole range of deciding who an organization or partnership could be held accountable to. Accountable to the people who give them the money, accountable to the people who found it, accountable to the beneficiaries. It raises then questions of for what, and I use the same four categories again: inputs, processes, outputs, and outcomes. And again, lots of different ways, including the potential for litigation as well as public shaming through the media as mechanisms for holding organizations accountable. And including questions of changes in management. So when do you remove the CEO? How do you remove the CEO? Who gets to remove the CEO? And those sorts of questions. I don't think I need to go through why we care about accountability for this group. It's partly to assure that an organization is achieving its intended objectives. It changes performance over time. It does contribute to democracy, and it shapes public perceptions. So again, my goal here was to go beyond just a couple of ideas to actually see if the ideas are tractable and usable. And so I put them together into, both as an analytical tool and a planning tool, I put them into this kind of So the simple 2 lines, orthogonal lines, became suddenly much more complicated into a matrix that says the same categories: information to whom, accountable to whom, information on what, accountable for what, how informed, and how held accountable. And just filled in some of these boxes with some potential ways of thinking about how this would look for a public-private partnership. So that led me to the question of, well, how much? You know, what's the right level of transparency and accountability? And someone suggested, well, you could have minimal standards. Someone else suggested, you know, sort of thinking about ACA standards in terms of health insurance plans, you know, bronze, silver, and gold levels of PPP governance. The more complicated question is, who decides on the standards? So do you have some, and then that led me down another, this is sort of the institutional dimensions of the normative aspects of evaluating partnerships. National regulatory agencies, national law. I mean, we do have national laws that govern, for example, what nonprofit organizations have to do in terms of tax reporting, in terms of their national laws that govern private corporations, in terms of what they have to report, in terms of salaries and other details. You could have an ISO. You could have a kind of a self-regulatory, a PPP association that sets good partnership practices. It seems to me right now it's pretty much everyone on their own and setting up their own standards with although that is impressionistic, not based on any kind of analysis or empirical data from my part. So one of the real questions is what happens when partners disagree? And this leads us into the question of how do partnerships manage their partnership? It's always seemed my impression that partnerships work best when there are relationships of trust between the core partners. And it's those relationships of trust, I think, that are underappreciated in the field of public health and the role both in policy as well as making organizations work well. This is a paper that I looked at after I wrote the paper that all of you have received. It looks at hybrids and social enterprises that are really for-profit hybrids. I should say that I've had a reading group over the last several months with 2 of my colleagues in Boston. You're going to be hearing from them later today, Veronica Wirtz and Peter Rockers. And we've critically read a series of papers every week for like 3 months and talked about them. And this is one of the papers that we looked at. I particularly liked the phrase in that paper of multiple accountabilities disorder. So that organizations are confronted with multiple accountabilities that are being imposed on them and from different directions and different organizations. And part of the challenge then is how they manage the conflicting accountabilities in ways that help them achieve their goals, assuming that they're still moving in the right path. This is some of the applications for your work today. I'll be interested in the reactions from the panel members if they have anything to say about the paper or these ideas. I think it has implications for the next panel on the legal and regulatory aspects of PPPs. I think it has relevance for the panel later today about industry-led access to medicines programs. And I think it also has applications for the last session that you'll be doing today, where you're actually looking at designing governance for a partnership. Again, you know, this is a draft. I will be revising it and doing something with it. I'm not quite sure what. But I'm happy to receive any comments from people, either informally, either today or subsequently. My hope is that it helps to clarify some of the ideas of what we mean by governance for partnerships and maybe for other organizations, in arguing that these are two core dimensions that should constitute some of the minimal objectives in organizing these particular entities in ways that serve their public interest objectives. Thank you very much.
Now, because he will be leaving within the next, no, you can't escape quite yet, because you'll be leaving within the next hour and during the panel, clearly.
I'll be here until 11.
We'll be discussing, but are there, I would entertain a couple of questions on clarification from anyone. Yes, Joe Ivey.
Thanks, Michael. This is terrific. I want to go back to the issue you said about inclusiveness and engagement. This issue gets played out a lot, and you say it could be a vehicle for accountability or a vehicle for transparency, but often the concern about the power relationships, not calling it out. You sort of said you didn't call it out. I wondered, could you talk a little bit more about that? Because it's a kind of, it's one of these fundamentals that is in there. It could get buried and disappeared, or it could become pretty important.
So it's the question of participation. Who participates in governance and in what way? And is it a separate dimension? One of my thoughts about this is that it is a complicated question. And I know, for example, that the Global Fund has gone in the direction of having all different groups represented on the board. One of the challenges when you do that is that the board, one of the questions then becomes, who is a representative? Which groups should be represented, right? These are normative questions. And then the question is, well, at least some of the, and you'll excuse me, Mark, I don't have direct experience, but when you start getting a board with 50 people, it's very difficult for a board then to serve its strategic functions. It becomes serving as a representation, almost assembly, which is a separate kind of function than rather trying to either serve transparency or accountability. The second thought that I've had is, you don't want everything to be transparent to everyone, right? It's just, if you think about, even if you think about like sort of another metaphor for partnerships is marriages, right? What goes on between the parents is not always shared with the kids, even though they are very much part of that entity. I'm not saying that metaphor necessarily holds for all partnerships, but there's certain kinds of decisions that have to be made based on certain kinds of sensitive information that not everyone should have a right to. So this gets down to questions of what kind of information should be available to which groups. And if you want serious discussions of sensitive information, it's difficult to do it with representatives from all different groups sitting at the table.
Thank you. And I think that's a way of thinking about how these two key concepts can be used to examine any aspect that I think we will come up with.
Can I just say one more thing on that? That when I thought about it, I have an aversion to the WHO cube on UHC, and I did not want to create another cube of 3 dimensions. So I thought 2 dimensions is something that people can like visually and intuitively handle really well. 3 is possible. Anything beyond 3 is impossible. And the second point was I really wanted to see it as a means and breaking it down as part of the other 2 rather than as something separate.
Great. Thank you very much.